Welcome, Rotarians and guests, to the Rotary Club of York, where our mission is to improve life in the city of York by connecting our club's diverse community leaders through fellowship, action, and service. I am your president, Wilda Ream. As we begin today's meeting, I wanted to remind you that yesterday was Veterans Day. We welcome each of our club members and guests who are veterans and thank them for their service. I ask that you please be seated as JT Hand announces the Parade of Veterans, accompanied by Chuck Long.
Coast Guard, the Merchant Marines, and the Space Force. Don't do that to me. The first I can do. Just one. Coast Guard is. Wait a minute. That isn't that. That's a Merchant Marine.
Rotarians and guests, please stand as the color guard from William Penn High School JROTC presents the colors of the United States of America, followed by the opening song and Pledge of Allegiance by Jennifer Seal and the invocation by Eric Chase.
Pull. Two steps to the left. Mark. Right. Face. Post. Colors. Face forward, one.
Join me. Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets bursting in through the night, that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Will you prepare yourself in the way you're accustomed to prayer? Let us pray. Gracious God, our Creator, we thank you for men and women who are willing to serve to keep our country free, so that we may have the privilege to gather like this, so that we may have the privilege to worship in the way we feel comfortable, and so that we may be citizens of a free country. We especially thank you for our speaker today, who will talk to us about educational opportunities in the medical community and how bringing students to York to create a medical campus here in partnership with WellSpan in Temple. We especially give thanks and gratitude for the many blessings in our lives, including the food that has been served to us and the hands that prepared and serve it. May we use it to nourish our bodies so that we may continue to put service above self. And we ask this all in the many names we call you. Amen.
Rotarians, please join me in reciting the four-way test. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? And a little birdie told me that today is Andy Siebold's birthday. So happy birthday, Andy. Jody wanted to sing for you a solo, but we have a schedule. But happy birthday, Andy. And now I invite Todd Fogdahl to the podium to introduce today's visitors.
Good morning. I am pleased to have the honor of introducing our guests for today's meeting. When I call your name, please stand and remain standing until President Wilda has had the opportunity to welcome you. I will tell you it's a lengthy list, so you might be standing for a little while. As guests of youth leadership, we have Terrence Jones, Desire Dixon, Eric Schlosser, Daphne Barber, Jonathan Rivera, Aaron Dixon, Cassie Jones, and Emma Jones. Guests of the club, John Howard, Brad Maxwell, Jade Rivera, Luis Diaz, Michael Estevez, Freddie Hernandez, Donnie Maraskin, Kelvin Paez, Frederick Pillier, Waldemir Alicia. We have Shabnam Hafiz, guest of Aaron Rank. Nathan Moons, guest of Youth Exchange. Dami Odubunmi, guest of Garrison Markey. Jeff Vermeulen and Kevin File, both guests of Carly Legg Wood. Judith Akaha, guest of Jennifer Clancy. Cindy Cooley, guest of Lori Broadbeck. Alyssa Moyer, guest of Vicki Diamond. Martha Raphael, guest of Chad Myers. Philip Cloner, guest of Thomas Calderon. Bernice Quisenberry, guest of Jane Schusler. Kevin Wirtz, guest of BJ Fegley. And Barry Carbaugh, guest of Rich Randall.
Visitors, we're so glad to have you here with us today. Whether this is your first visit or you're back again, it's always a pleasure to have new faces in the room. If what you see here today resonates with you, we'd love to have you consider becoming part of our Rotary family. Rotarians, please help me welcome our visitors. You may be seated. And now for some announcements. The club sends get well wishes to Walt Tilley, who is recovering from a broken leg as a result of a bike accident this past weekend. The Rotary Club of York Board of Directors will meet tomorrow, November 13th at 8 o'clock on Zoom. The Membership Engagement Committee will meet on Monday, November 17th at 8 a.m. on Teams. And the Program Committee will meet on Wednesday, November 19th at 11 a.m. here at the Country Club. And as a reminder, there is no club meeting on November 26th. At this time, I invite Katie Caples to the podium for our Students of the Month.
Thank you, President Wilda. I have the honor today of introducing two wonderful Students of the Month, both juniors at William Penn Senior High School. I'll introduce them together and then they'll come up and say a few words. First, Desire Dixon. She is involved with York College Community Opportunity Scholarship Program. She's in the STEAM program. Her hobbies include dancing, running, drawing, and cooking. She's at the top of her class, enrolled in AP and honors courses, and would like to, as her career, pursue entrepreneurship, mental health services, and/or be a spirituality coach. I asked Desire, who was influential in the first 5 years of life. Many of you know the early learning initiative that I lead, and so I had to go there. And she pointed to her grandmother, Daphne, who really cared for her and educated her in those first 5 years. And it's great to see you here today. Next up, Terrence Jones, again, a junior on the football team, sore subject, apparently. I don't follow their program, but he's had a great junior year and looks forward to his senior year. He has worked on a Little's Libraries project, is involved in the STEAM program as well. Hobbies include football, gaming, and reading. He's on the honor roll. Is enrolling in dual enrollment as well as honors classes, and is pursuing business. He wants to go to a 4-year school and obtain an entrepreneurship degree and open his own business one day, hopefully joining us at some point here. Asking him about his first 5 years, he's a Crispus Attucks alum. So without further ado, Desire and Terrence.
Hello, good afternoon. My name is Desire Dixon, and I'm an 11th grade student at William Penn Senior High School. I'm going to be looking at my phone a lot, guys. I'm sorry. There are a lot of things I aspire to, and I will be honest, being asked the daunting question, what do you want to pursue when you're older, tends to stir anxiety in me. But over time, a good answer to that question has reached the surface of my inner being and is now very clear to me. I want to pursue Jesus. My experience getting to know Jesus has changed my life and has been the defining factor of my success in high school. In middle school, I didn't really know Jesus, and I was surrounded by many negative influences, all of which were pulling me in the wrong directions. When I came to William Penn, something changed. I wouldn't say God changed my surroundings, but he changed my heart for the better. And he began to reveal to me that I was set apart and that I couldn't always do what others did. Or as my grandmother said, I wasn't made to follow the crowd. This realization was something I at first struggled to see and understand, but once I did, I found myself enjoying my pursuit of education and even developing a love for learning. These were qualities I struggled to find. Struggled to find in those negative influences and people I was still surrounded by, and this discouraged my pursuit of passion in school until God ushered me into a season of isolation where he cultivated dependence upon him and his strength, and he made me strong. I did not like being isolated, and the path I took and still walk can be lonely at times. However, if it hadn't been for God showing me that I could do and accomplish all things through him, I may not be where I am today. When I finally understood the truth that Jesus is my true passion, I started to walk in that truth, and he began to work on my heart, especially concerning my pursuit of academics. In other words, when I learned to put God first, he changed me and helped me with everything else I wished to accomplish. One of those major things was accomplishing success in school. And not only did I succeed, I actually excelled. And I have now fallen in love with furthering my passion for Jesus as well as my improvement in the classroom. After my season of isolation, where God taught me to depend on him for all my wants and needs, he began placing better, more inspiring people in my school life who encouraged me to push past hard trials and be successful. I'm extremely grateful for this experience, and it shapes my growing discipline and who I am today. Thank you.
Hello, everyone. I hope everyone is doing well. And before I start, I just have to say one thing. When I heard I got nominated for this and I realized I had to give a speech, I knew there was only one thing I could talk about, and that's the AFL CAP program. Although on the surface, this just looks like a program that is mainly to better us for football, and while it does do that, going through the program for almost a year showed me it was so much more than just that. I feel that without AFL, I wouldn't be the person I am today, and I might not even be here now speaking to everyone. I think this is because the environment, the people, and the way things are handled there is something I wasn't really used to. One thing I can say that I really enjoy about the AFL program that has nothing to do with the football aspect is the leadership meetings we have every Wednesday. These meetings are ran by our coaches or mentors. These meetings can be about so many things, like our futures, goals, or what kind of person we want to be. I've learned a lot from these meetings because no one's allowed to stay quiet. Everyone has to stand and talk about the topic we discussed that day, which gives insight on what others are thinking. An experience that I feel it really affected me is when we were having one of these meetings and we were talking about what we wanted from AFL and our goals. Before we started, one of the coaches said something I feel really described me at that time, and that was to not be a fraud. And by that, he meant don't say you want something, but then behind closed doors do nothing to gain that. This stuck with me because it made me realize that at that time, I was being a fraud. And ever since then, I feel like I have changed for the better. Honestly, the program has also made me a much better leader and using my voice to advocate for what's right and what the guys around me should and should not be doing. Lastly, I want to thank Mr. Schlosser and thank everyone else for allowing me this opportunity to share my experience. Thank you.
Wow, what an honor it is to be named Student of the Month by your school. We know how much hard work goes into earning this recognition, and showing this level of leadership at such a young age is truly remarkable. The world desperately needs your continued service and leadership. Keep serving your fellow students, your family, and your community. Our club is incredibly proud of you and wishes you the very best in everything that you do. Thank you. And now I invite newly published author Leanne Wilson to the podium for a volunteer opportunity from youth leadership.
Thank you. So in the room today, we have a lot of our students with the Students of the Month and the JROTC from York High. So I had the opportunity to ask them if they remembered their time at BizTown at Junior Achievement. And sadly, it was COVID year and not all of them got to participate. So thankfully that's over and everyone in 5th and 6th grade now gets to go to BizTown. Those that did remember and had the opportunity to go, remember being a penny roller manufacturer and an engineer, and those two are heading to the armed forces. So the day is about getting 5th and 6th graders to understand what it's like to be an adult, more or less, having a job, understanding how finances work. And in order for that day to function properly, they need adults. So that's where we are coming in to be the volunteers to help them run the town for the day. As part of our mission to improve the life of York, the city of York, and focusing on cultivating youth success, this is another volunteer opportunity. So on January 8th, we will be working with the students of Ferguson Elementary and Smith STEAM Academy. And then there's a second date on February 17th where multiple Rotary clubs are coming together. So if one of those dates works for you better than the other, both would be helpful in helping to fill that out. There are tiny little slips of paper with the QR codes. Pick the left for January, pick the right one for February. And if you have any questions on how to participate and what the day looks like, please ask me. Thanks.
Thank you, Leanne. A great opportunity to give back and help achieve our mission of student success. And at this point, I invite Aaron Rank to the podium to introduce our speaker for today.
Thank you, President Wilda. Good afternoon, or afternoon, everyone. It's an honor to introduce our program today, which is about a recent agreement between WellSpan Health and the Temple University Katz School of Medicine to open a 4-year medical school right here in York. That's right. Before I invite our guest speaker up here to the podium, I wanted to share a bit about how this program came about. I first learned of the new medical school when my wife, who's joined us here today, who's a trauma surgeon and the chief of emergency surgery at WellSpan, forwarded the press release to me. And I know from her quest, from our personal experience, that to find a position I know from her quest to find a position after completing her residency training in Washington, D.C., that WellSpan already stands out from competing hospitals in the region because of the robust surgical program, residency program, as well as the institution's broad commitment to medical education. So the addition of a medical school is exciting news for her and all of her physician colleagues because it continues to build upon this commitment to medical education and will help to attract and critically to retain physician talent here at WellSpan and here in central Pennsylvania. The executive at WellSpan who's done perhaps more than any other to help bring about this partnership is Dr. Tony Aquilina. Dr. Aquilina joined WellSpan about 5 years ago, where he serves as executive vice president and chief physician executive for the health system. In this role, he acts as president of WellSpan Medical Group and clinical executive of all of the service lines in the health network. He came to WellSpan after 25 years with one of the most highly regarded health networks in the country, Geisinger Health, where he was regional president of Geisinger Northeast. A Penn State alum, Dr. Aquilina earned his medical degree from the Philadelphia College of Osteopathic Medicine and an MBA from Auburn University. Dr. Aquilina, thank you for taking the time to join us today. We look forward to hearing about this new partnership, what it means for WellSpan and our community.
Thank you, Aaron. Before I start, I got to say I'm a little choked up between Desire's conversation about her spirituality and the parade of veterans. I'm not sure I was expecting that. So I do kind of feel like Veterans Day shouldn't be a day. It should be every day that we appreciate and thank and remember those past and present who basically have committed to keeping us free, right? So let me reintroduce myself. That's my highly touched up official WellSpan picture. My name's Tony Aquilina. I'm a primary care physician by training. I spent many years taking care of patients, and now I work at WellSpan. And basically my role is to work with our chief operating officer to oversee everything we do from a clinical enterprise. And that includes the physician group, the 9, soon to be 12 hospitals, our academics and research, our value-based commitments to insurance, working with insurance companies. And, you know, it sounds like a lot, but the reality is that, you know, we have a very strong organization that allows us to do cool things like use AI to help caregivers deliver better care and to develop a medical school. Just really, let me set this up before we talk about the medical school. About WellSpan, we employ about 23,000 people, and we employ about 2,500 of those are doctors and advanced care practitioners. So when I started 5.5 years ago, that number was about 1,400, and now it's about 2,500. So we're growing our commitment to deliver great care in central Pennsylvania. And to do that, you have to have the people who are trained to do that care, to deliver that care. Also, when I went to medical school, no one taught me what a credit rating was. But after years of working with CFOs, I've learned that that's a good one on the bottom line. So the top 20% credit rating, AA minus, and so those of you in business know what that means. All I know is that our CFO is very happy. So I think we're one of the top 2 rated health systems in Pennsylvania in terms of credit rating. And why does that matter? Well, it matters because, you know, as customers or potential customers in South Central Pennsylvania, you want to know that we're going to be here. And there's a lot of health systems in trouble right now, right? Tower is in Reading is the biggest example of that, on a lot of financial trouble. And with the changes that are happening with Medicaid, they you know, a lot of, even our partner Temple in the medical school, very concerned about their financial stability. And we have the luxury of being able to run a good organization that can weather any of these storms. This is just a little bit about our market trends and where we are. You can see we're in quite a few counties in South Central Pennsylvania, but also now in North Central Pennsylvania in the Lewisburg area with our acquisition of Evangelical Hospital, which is not a large hospital, but it's a really good hospital, and it worked, and it was a really good match for our organization. You can see that we have a dominant market share in essentially all of our markets, except Lancaster County, where of course Lancaster General Hospital is the big name in town, but we're second. And in North Central and Lewisburg area, because Geisinger is only 20 minutes away, but that's fine. They all do very well. And again, this speaks to our growth and our ability to maintain a strong organization. You all know about WellSpan York Hospital. It's, maybe you don't realize some things about it. Very large hospital, 600-bed hospital, very busy place. York Hospital alone employs over 5,000 team members. We're a level 1 trauma center. Now I'm going to tell you something. Pediatricians and surgeons don't necessarily get along well. So when I say a level 1 trauma center, level 1 is the best. Okay, doesn't get better than that, which is one of the reasons why, you know, we've had several very public events happen in the last 6 months with shootings of, unfortunately, of police officers. 3 events in 6 months, and they've all come to York Hospital. They were all taken to York Hospital, and we did amazing work with them. And I say pediatrician, I make that pediatrician remark because we're a level 3 neonatal intensive care unit. So that's the opposite. Higher is better because, you know, medicine isn't complicated enough that the pediatricians and the surgeons figured, you know, we're just going to make it harder to understand. We'll make trauma centers low numbers and NICUs high numbers. So just, yeah, I feel like it's my job to explain the silly things we talk about in medicine. Some important things, and this is important to us, but it should also be important to you. We're a Leapfrog A grade hospital, graded A. A is good. You know, they were smart enough to keep it normal, right? A is the best, which means an outside agency, Leapfrog, which has nothing to do with us. We don't, you know, we have no influence on how they grade us. The government doesn't have any influence on how they grade us. They graded us the highest that you can get for a hospital for quality and safety. And only about 30% or so of hospitals get an A grade. We have an A grade in New York, and I'm very happy about that. And I know, I believe that Vicki Diamond talked to you about our hospital expansion, which is, should be completed by fall of 2027. It's about a $450 million expansion into new surgical and critical care tower, larger surgical suites, pre and post-op areas, multiple floors of intensive care units, each specialized. One will be cardiac, one will be neuro, one will be trauma. So, really the highest level care that you can get, we're going to make sure happens right here in York, Pennsylvania. It's something we're kind of proud of out of that. 80% of the subcontractors who are working on that project are local. So we're keeping all that spend here, right? A lot of things going on in the medical industry. We've gone through a tumultuous couple of years, precipitated by COVID. We'll call that the crisis years, and it truly was a crisis. I know there's a lot of talk about COVID on the internet, social media, and let me tell you, it was very real. Every year we have a dinner for the survivors of the sickest of those people. People who have had to have something called ECMO, which is extracorporeal membrane oxygenation. Basically, it's a machine that oxygenates your blood for you because your heart and lungs don't work anymore, but you're still alive. This is the most extreme thing you can do to save someone's life, and we did it extensively during COVID. And if you saw these people come back every year for this COVID survivors dinner, and it's just amazing the gratitude they have for being alive. And some of them are amputees, some of them have had all sorts of bad things happen to them because of COVID that they'll live with the rest of their life, but their incredible gratitude just to be alive and be with us. That was those years. Then after that, COVID kind of stabilized and the industry kind of stabilized. That didn't last long. 24, we call it normalization. It's really not, because what happened during COVID is a lot of care didn't get rendered. And now it's being rendered with a vengeance. So there's a lot of demand for healthcare right now, so much so that it's hard to keep up with it. Insurance companies are going crazy because they're paying for this. They might not want to, but they are. And now, and what's not on here, of course, in 2025 is everything that's happening with the government and how that's affecting healthcare. And, I mentioned Medicaid and the changes that are coming in Medicaid. And this is not a political statement, but just understand it is going to affect our ability and many healthcare systems' ability to continue to sustain to sustain themselves. There's going to have to be ways systems are going to have to find ways to keep themselves alive. A big part of what's happening in healthcare is the continued rise in demand for healthcare workers. So Americans are getting older, right? Americans are getting less healthy. It's unfortunate to say that, but it's true. The main reason for that is obesity. We have just an incredible obesity epidemic in the United States. And it all happened very quickly. In a matter of 10, 15 years, a dramatic change in that. That is the main reason. There's other reasons, right, of course. But the demand for healthcare is soaring, and we need people to provide that care. So that is really the reason that I'm here talking to you, to talk a little bit about the things we're already doing, but also to talk about the exciting work we're doing to develop a medical school so that we have doctors who are trained here and stay here. Just for those of you who, getting to the age like I am, where things in your body start reminding you that you're getting to that age, I'd be a little nervous, and I am a little nervous. Pennsylvania alone in 2026 will have a shortage of 20,000 nurses. 20,000 nurses. They're very important, those nurses. And so that's just one example. And for physicians, though, and I'll ultimately talk about the medical school. Pennsylvania is actually, comparative to other states, not that bad in terms of a physician shortage. But across America next year, about 125,000 physicians short as a country. We're not producing enough of these folks. It's not that people don't want to go into medicine. They still do. We still get lots of applications in all of our medical schools, but there's just not enough spots to keep up with the demand. It's a supply and demand equation. You know, so we make people healthier, maybe there'll be less demand, but we're still all getting older, right? So a couple of the things that we're doing already. So 2 years ago, we started a partnership with Jersey College School of Nursing at WellSpan Health. Recently, you know, and this is a 2-year program. We start them in cohorts every 6 months. So we've recently started our fourth cohort of 52 new students. So we have in the college right now over 200 nurses, because the fourth cohort is the first cohort of those 4 is scheduled to graduate this August. So technically they're still in the group. So we have about 200 plus nursing students that just since the last 2 years. And we work with these students. A lot of these students are not right out of high school. A lot of these are second career people who just want to advance their lives and understand that nursing is such a noble profession. And by the way, it pays pretty well. So this is a great opportunity for people in our community to advance themselves and at the same time give us something we badly need, which is good nursing. We're providing a lot of incentives for these folks to stay with us at WellSpan. And we've already got loads of commitments to that, including financial reasons. You know, we give them scholarships, we make commitments to them and they make commitments to us. So this is the start of replenishing our workforce, starting with nursing. We also have an extern program that works with people who want to experiment and understand what healthcare is like. And so it says we have 121 summer nurse externs. These are people who are thinking about it, right? So we want to they come, we provide a couple months of exposure, and hopefully they decide to choose nursing as a career. We also have a scholars program that works with other nursing schools, as well as imaging, which radiology and physical therapy professionals. So we're not just doing our own, we're working with other schools who provide this training. And we provide these folks up to $65,000 each in financial assistance. And with that comes a commitment to work with us when they're done. So we're trying to work with local universities, institutions, not just doing this ourselves. We're big believers in partnerships. And you know, this is already paying off for us. All those other disciplines that I mentioned there, imaging and physical therapy, also in high demand, especially imaging. I mean, it's just, we cannot keep up with the demand for MRIs and CAT scans and things like that. Every one of those tests requires a trained professional to do, right? It's not just the guy reading it. It's the person in the room with you, getting you set up and getting the test done. We've trained physicians in residencies and fellowships at York Hospital. Anybody want to take a guess how many years we've been doing this? 103. We've had residency programs at York Hospital 103 years, 1922. So we've been in this game for quite a while. You know, it certainly started small, and right now we have 12 residencies and fellowship programs, and growing. We have the luxury of being able to add when we see an opportunity to do that. 60 physicians graduated these York Hospital training programs this summer. Of those 60, 15 stayed with our medical group. That is a really good number. That to be able to keep 1 out of every 4 of your trainees is a really high number. Every other institution around us is very envious of that ability. Why are they staying with us? Because we're making it a good place for them to work. It's pure and simple. Our doctors like working with us in general. You know, there's always a few grumpy people in medicine, but in general, they like working for our medical group. We have very low turnover. You know, we have a turnover rate in our medical group of only about 7% a year, and that includes people retiring, right? So we try to make it a good place for physicians to be here in South Central Pennsylvania. In addition to 15 people who we hired, 2 of them stayed on our fellowship programs. And our most recent fellowship program that we started is cardiology. So we do incredible cardiology work at York Hospital, things that no one else is doing, I'm telling you. And I'm not just making this up. I mean, this is absolutely true. We started a cardiology fellowship 2 years ago when we're getting our second group in, and we're training some good cardiologists, and hopefully they will stay here in York. Because we're all probably going to need a cardiologist. You live long enough, you're going to need a cardiologist. Medical laboratory is another program we're doing. It's a year-long program. Again, every time you get a blood test, someone's got to run that test, right? This isn't a physician. These are lab technicians. There's nowhere near enough of these that are needed. And so we developed a year-long program, which has been in place for a little while now. And by the way, has a 100% first-time pass rate. Our programs, our graduates, 100% for pass their certification the first time they take it. National average is about 60%. So we're doing something right with these people. And 11 of the 12 of our last graduate team joined us. And finally, before I get to the medical school, we have a radiology. I mentioned this is a partnership with our wonderful partners at York College, an Associate of Science degree in radiography. These are the people who take your x-rays. This is a 3-year program. It begins very soon. So let's talk about the medical school. So how did we come about deciding to do this? Well, it was mainly our CEO, Roxana, saying to me, well, like, what are we missing? And what's it going to take to get this to this organization? And I said, medical school. We need a medical school. Why? We're surrounded. Think about WellSpan and who we're surrounded by, right? In Baltimore, just an hour down the road, down 83, we've got Johns Hopkins, University of Maryland, right? Go to the north, you got Penn State Hershey, UPMC is in Harrisburg. University of Pennsylvania owns Lancaster General. WellSpan is surrounded by the biggest names in medicine in the world, literally with less than an hour away. So what does WellSpan, which is a community-based, community-owned, the only community-owned health system, by the way, around here anymore, what are we going to do to make sure that we're continuing ourselves and sustaining ourselves and attracting the best people to practice here? And this is the answer. Why did we partner with Temple University? Well, let me tell you, we did an RFP. Lots of medical schools had an interest in us. We're hot here. Like President Trump says, we're a hot country. We're a hot health system in a hot area. It's a growing area, right? This area, Pennsylvania is actually growing in population, right? We have good demographics, good people who work hard. This is a very attractive area to be. May not seem it sometimes, but it is. And we've had a lot of interest of medical schools. And I won't mention their names because we didn't choose them. We chose Temple. And the reason we chose Temple is 2 reasons. One is they said this is going to be a partnership. We are not going to dictate to you everything that needs to be done. This is your medical school, and we're going to partner with you in running it. Because our interest here is that this is a WellSpan York County-based medical school. And we want to look to students within a radius of South Central Pennsylvania who want to commit themselves to this area. Right? That's who we want to attract. They said yes. They said, we're your partner. We don't run this and tell you what to do. We're your partner. Loved that. Second reason is they've done this already. Right? They have a partnership with St. Luke's in Bethlehem, Pennsylvania, and have had it for 14 years. Very successful campus of their medical school. They produce great doctors. A good percentage of those doctors stay in Bethlehem at the St. Luke's organization. We vetted this through St. Luke's, and they said, yeah, the Temple's the real deal. So the name of it is the Temple University Lewis Katz School of Medicine at WellSpan Health. At WellSpan Health, and that will be our logo. And you can say all the bullet points are there about why we want to do this, but I think it's pretty obvious, right? This will be the third, as I said, Temple's, the third part of Temple's medical university system. The main campus, St. Luke's of Bethlehem, and us. And that will be the system. But again, it's WellSpan Health. And so we will have a committee, a admissions committee here. We will make sure that we're partnering with them to run the show. They're the experts, but it's our school. This is a picture of the leadership team. There are 3 Temple senior leaders there. The person next to me at the end is John Fry. He's the president of the entire university. Good man, has done a great job there. The height challenged woman next to me is Amy Goldberg. She is the dean of the Temple Medical School, trauma surgeon, wonderful person. The attitude from Temple was, we're your partners. You're our equals. And that's the way she behaves. And that's the way we're going to run it. And the person next to her, some of you may know, Mike Young, he used to run Lancaster General Hospital. And now he is their retiring CEO of their health system. Also in the picture from WellSpan, besides me, is our CEO, Roxana Gabster, who many of you already know. And the gentleman to the right with the biggest smile is Dr. Mike Bourne, who will be our associate dean, and he will be the dean of our Temple WellSpan Medical School. He's currently our chief academic officer. He reports to me, and he will be the running the show. Before I talk about philanthropy, let me just tell you a couple of facts about the medical school. The things that we're doing now, okay, to make this happen so that we can start students in the summer of 2027, right, which is not that far away, right? We're working on facilities, okay? So the site will be out on Whiteford Road near our current academic campus, which is where the medical school is. It'll be great visibility from Route 30. You'll be going down the Mount Zion exit. There'll be a big WellSpan Medical School sign there. Okay, great visibility. We have a building already. We're just going to convert the building to what we need for a medical school. As I said, we expect our first student to start in July, August of 2027. Between now and then, we have to get an accreditation. We expect that to happen January or February coming up. We don't expect a problem. We know that we've done everything right. We expect to get fully accredited right from the get-go. When that happens, that'll be a big deal, and we'll start to be able to recruit students. So we're putting this all together. 2 years to actually 3 years from when we started is not a long time to get one of these things going, but we're going to do it. We're going to be on time, and we're really excited for the first class to graduate in 2031, which sounds like a long way away, but it's not, right? So that's the update of where we are. We're very happy with our partnership. I would show you architecture renderings, but I don't think our facility teams really wanted me to do that because they'll change it 5 times. And then they won't tell me they did that. So that's where we are. Now, I would not be doing my job if I didn't say to you all, we're going to have a lot of philanthropy involved in this. We've decided to not do philanthropy about a building. Although if someone wants their name on something, we can arrange that. What we've decided to do is philanthropy for the students, not for us. So we're going to start a Temple Medical School Fund, which is, and it says Temple Medical School Fund because it's technically an extension of what they already do. which is why they have a name on their medical school. But the philanthropy will be directed to help students who want to be in central Pennsylvania to practice medicine and take care of all of us, to help them offset the tuition costs. That's where it'll go. And you know darn well, you've heard stories, and this is absolutely true. Many of these medical students are coming out of school with $200,000 to $400,000 worth of debt. If we can help them, that will be a big deal. So we are doing both internal, we'll start external fundraising. We're certainly doing internal fundraising already to make sure that we have a support system so that we can give scholarships because it shouldn't just be for wealthy people who are able to go to medical school, right? We want everybody to represent our community here. So that's where we're going to direct. It's called the iGive project, and it's, that's where we will direct anything anybody gives us will be towards that. Again, unless you want your name on something, then we'll talk separately. Thank you. I'm happy to take any questions about anything I said or anything that I can answer. Any questions, concerns? Maybe not. Roger, you
Hey,
must
thanks
have a
so much,
question.
Dr. Aquilina. One question. Sorry. Hey. So I'm guessing this is a graduate program. Is there an existing pipeline to go from York College of Pennsylvania to this medical school?
Yeah, we're going to, Mike Bourne, who is the dean, as I mentioned, I showed you his picture. He is working with multiple local colleges to develop what we call pathways. And it will be York College, but it's not just York College. We're talking to other places too, Elizabethtown, even Hack. So we'll talk to multiple of the local colleges and universities, and they're all interested. They're all very much interested in us having this pathway. And that's the goal, is to attract people that are from here and want to commit themselves to here. Now, that won't be everybody. I mean, obviously, we're not going to, discriminate like that, but, that's why we're doing this.
How much investment does it take to get this thing off the ground?
Well, we do things very efficiently at WellSpan. We already had the building, so we have a building conversion. We have to hire people, so there is a real financial commitment, but we think it's worth it, and we will absolutely not shortchange the students, but we also absolutely are very disciplined in how we spend money. So is there an exact number? I don't have an exact number, but if we had to build a brand new building, it would be a lot more, but we don't.
Real quick question. Are you doing a grassroots type of program that will actually filter some of students from, say, high school into these programs and then ultimately?
Already do that. We already have wonderful partnerships with high schools, and it's a lot of it's right now for what I mentioned on the other disciplines, because there's a long road from high school to medical school. But there's a lot of there's direct roads from high school to these very well-paying jobs, nursing, radiology, techs, lab techs, well-paying jobs, and they don't even require a four-year degree. So we have direct programs with high schools and to attract students into these disciplines. And students don't know these disciplines even exist until you talk to them about them and say, hey, this is what they would do, and we demonstrate it, and they say, wow, I could do that. And then we tell them what they pay, and then they really say, wow, I could do that. Yeah.
Thank you so much for your presentation. So as you're speaking about this new school coming online, we're also seeing a school here, Sunset, which is Penn State York, and that beautiful campus kind of sitting there. Too bad we can't just slide the one into the other, but loving that you're converting a building. But one of the challenges, and ultimately why the Penn State York campus is not going to stay, is because there's no housing that comes along with that. Do you have a plan, or do you get students that will be coming from far enough away that housing is a concern?
Well, there's lots of reasons that's not staying. That's one of my guess, but The bigger reason that's what I'm saying is, you know, decreases in the number of enrollment, right? Look, I mean, a college like that enrolls, you know, ideally it would be 1,000 students. We are 40 students a year. So it'll be after, you know, our max will be 160 students, much different kind of situation. Medical schools don't traditionally provide housing. I mean, I didn't have housing. I had to find an apartment in Philadelphia that, you know, my parents were concerned about, but that's besides the point. But we do a lot of work with your college, and they have room. And so we are going to talk to them, and we are talking to them already, right? About whether they can, whether we, you know, this wouldn't be free housing. These students would have to, you know, rent them, but that's ideal because it's kind of right across the street from the York Hospital. Right? Am I done? Right. Yeah. Thank you, everyone.
That's the hardest part about being president, other than ringing the bell loud enough for Doug's satisfaction. I hate cutting his beers off. Thank you, Tony, for sharing such exciting vision for the future of healthcare in our community. The new partnership between WellSpan and Lewis Katz School of Medicine is truly a milestone for York County. It's inspiring to hear how this initiative will not only train future physicians and other medical personnel, but also strengthen the pipeline of medical talent right here in York County. We appreciate your leadership and WellSpan's commitment to improving care and investing in the next generation of healthcare professionals and our broader community. So please join me again in thanking Tony for today's presentation. So as you know, our speaker has signed a book plate to be donated for the book to be donated to the William Penn High School, along with a bookmark made by students at Creative York. This week, it's The Alchemist. Break from the octopus theme that we've been having. Next week, we will hear from Jeremy Feekins, who will present on the Union Lutheran Church Redevelopment Project, known as the Union Apartments, a transformative affordable housing initiative located on West Market Street in York City. He will discuss how the redevelopment project addresses urgent gaps in housing, community services, and neighborhood revitalization. Learn how this initiative represents a bold step toward inclusive growth and long-term community stability in York. Members and guests, please stand for the retiring of the colors.
Mark time, march. Color guard, pull. One step to the left, march. Right, face. Retrieve, colors. Right, face. Forward, march.
And with that, our meeting is adjourned. I look forward to seeing you next week.